My name is Dr. Kristen Higgins. I'm a radiation oncologist at Winship Cancer Institute at Emory University. I'm an associate professor and I specialize in the treatment of lung cancer. This can be a difficult situation. Many times when it comes to using the targeted radiation approach with SRS, we're able to do that if there's 10 lesions or less. Once there are, over 10 areas of metastasis in the brain, we have to think about using a more comprehensive treatment. And what that consists of is something called whole brain radiation therapy, where the entire intracranial contents in the brain gets radiation. It's typically delivered over 10 treatments. Each session's about 15 minutes long. There are some new ways that we're delivering this whole brain radiation to improve the side effects. One new technique is called hippocampal avoidance whole brain radiation. And what we're able to do there is carve the radiation dose out of the bilateral temporal lobes. And that's actually the anatomic part of your brain that helps create new memories. And so there's been studies that show if you use this approach that you can actually reduce cognitive changes after the whole brain radiation. And it's a great new technique to limit the side effects of patients that need whole brain radiation therapy. Now, there are some other scenarios where we may think about a different approach rather than whole brain radiation for those too numerous to count brain metastases. All stage 4 lung cancer patients will undergo molecular testing of their tumor. If there is a targeted mutation and there's a drug that has CNS penetration while targeting the mutation, we will occasionally go ahead and start that drug therapy and see if we can get a response in the brain. And we do that for patients that have, these very small tumors that are not causing symptoms. And that's sort of the best patient to use this approach. Of course, if you are going to use the drug therapy, it's important to do frequent MRIs to make sure that none of the tumors are getting too big and starting to look like they need radiation. And that's an approach that is used really with close coordination between a medical oncologist and a radiation oncologist to make the determination if and when radiation should be used.